French scientists used to come to my lab, whether at Ames or at NII. All the time I had somebody or the other, sometimes a series coming. So there has been a collaboration.
Thank you very much, Professor Talwar, for agreeing to talk to us. It is an absolute pleasure. My first question to you is, what were your motivations to become an immunologist?
Well, I recall that in 1970, when I was the professor of biochemistry at the All India Institute of Medical Sciences, a team from WHO, composed of Howard Goodman, who was the chief of immunology at WHO at that time, along with three very famous immunologists, Alvin Cabot, Barry Bloom. They came to see me, and they asked me to take over the headship of a WHO research and training center in immunology that they want to establish. Well, I was not working exactly on immunology, although at the Institute Pasteur I had done the usual courses and they had in immunology too. But anyway, I said, why me? Why don't you ask somebody else who is in the microbiology or clinical? There were immunologists in there.
You were in biochemistry.
I was in biochemistry. They said, look, we have come to you with a purpose.
Okay.
India has the world's largest number of lepers. Do you think the Americans will come and solve this problem? So this statement put me a bit into shame. I knew nothing about leprosy, but they have come here to ask me to take over the WHO Research and Training Center in Immunology because they say that people like me should attend to problems such as those of leprosy. So I did feel ashamed and I signed the papers immediately. My next task was to go and learn about leprosy. So the next 2 summer vacations I spent in Aska and Pogri in Odisha in a Danish Save the Children leprosarium. I took a mobile laboratory with me, and I also took 2 of my students along to learn why people get leprosy. Because the majority of us don't get it. More than 98% remain healthy, as you see all along the India. The few who get it, what is wrong with their immune system? Then they become victim to it. So this was the beginning of my getting into immunology. And to, again, not only just immunology for immunology's sake, but for a purpose. And that purpose was to sort out, if possible, a problem relevant to the country and to the world at large. And so, you see, this is how started. And in fact, why the people become victims of leprosy, I could find out by my research. Those who become victims, they are unable, or their immune system is unable to react with some key antigens of M. leprae. That was the defect, and that is why they get the disease. They cannot mount an immune response. Most of us can. You can, I can. But those who become victim cannot. So having found that, which of course is published in many international publications and in Leprosy in India too, the whole Golden Jubilee issue is devoted to it. But you see, having found that out, the next obvious question was, can we do something to make them immune? And that is how I started working on a vaccine for leprosy.
Wow.
For leprosy.
That's fantastic.
As you know, I have succeeded ultimately in making one. And this vaccine is now approved. It has gone through trials, not only phase 1, phase 2, phase 3, but also field trials in Kanpur, Dehat. And it is approved by the Drug Controller of India. It is approved by the US FDA. It is the only vaccine of its type in the world for leprosy. So this is from India's contribution to the world.
Yeah.
We have given it to a company which makes it and which sells it. Now what is amazing is that originally we licensed it for leprosy, but they're selling it under different names at much higher price for sepsis, for tuberculosis, difficult to treat tuberculosis, for cancers. I already told you some cancers. And what is more, even currently, the CSIR and also PTI and AIMS have undertaken a study on the COVID patients to see whether this can help in any way. Would you believe it even helps such cases? I have here 2 publications on COVID
So
recently.
that's like an immuno booster?
Well, here it is. Here is first in tuberculosis, which people are finding difficult to. But you see, even on COVID, and here are the people who have done that trial.
Wow.
They are amongst the many most known people. So it's a immuno invigorator of immune response, over and above its ability to act against leprosy, as well as against tuberculosis. You know, it can sort of cure category 2, difficult to treat leprosy, tuberculosis patients. Here you are. I'll show you these. Please come see. See, first of all, in leprosy patients, when you give, there are no blemishes.
Interesting.
They are not only cured much earlier, but what is interesting is that drugs, had you given them only drugs, they may have been cured microbiologically, but not, blemishes would have persisted. You could always say this fellow was a leper. But having used this vaccine, look, they don't look
Miraculous work.
that, see?
Yeah. Wow. This miracle.
I'll give you bigger pictures of this.
Yes.
This is how the microorganism is.
Oh, okay.
This is the mycobacterium. You see, its genome has been, its gene sequence has been determined. It's a unlisted bacteria in the World Depository, and it has been named as Mycobacterium indicus prani. Indicus India, Pran is my family name, NII is the National Institute of Immunology, from where the trials were created.
That's amazing.
Mycobacterium indicus prani. And this is what it looks like as a Raman spectrum. By the way, it has also been used for totally unknown purposes. At AIMS, Sumesh Gupta uses it for the anogenital warts. Here. Cured.
No.
This is for cancers, myelomas. I'm going to use it as an adjuvant in the birth control vaccine, which is currently, which is genetically engineered now. In cancers, see.
Very, very effective.
Yeah. So it's a very interesting bacteria. I'll give you bigger pictures if you'd like to have them.
Tell us more about your days at the Pasteur Institute.
Pasteur Institute. Well,
It was
let me first tell you how it all happened.
Yep.
I did my BSc Honours MSc Technology from Government College Lahore. So, you see, then the partition happened. And all of us were refugees. Those who escaped being slaughtered came here as refugees to start life afresh from zero. And, well, I had a close friend, Madanjeet Singh, who ultimately was also a very good photographer and author. He joined the diplomatic services later on. But anyway, both of us used to meet. I got ultimately a little job of 200 rupees in a shop which sold, paper, imported paper. This was a Segal Brothers opposite Marina in that building that is standing there. We used to work there till 5 o'clock. Then Madanjeet used to come to take me to have a cup of tea at Quality. Quality had opened, it was a good tea. Both of us talked and we talked about our misery. Look, hum science padi, technology padi, kya kar rahe? Doing odd jobs here and there and at a low price. So then there was an advertisement where foreign governments had offered scholarships to Indian students in their countries. So both of us applied. And interestingly, both of us were selected. I chose to go to France because I was a leftist.
Okay.
So I said liberté, égalité, fraternité. You see, that's the liberty, equality, and fraternity was there. So it's a good country. Good. We went. When I reached there, the people asked me, what do you want to do? I didn't know what to do, where to go. So as we had studied MSc Technology, so I said, maybe Institute Pasteur, where I thought I'll learn fermentation technology. And when I go back, I'll open a small factory. And, as the temperature in India is in any case near about 37, 38, so you won't have to use fuel or very little fuel in winter only. So this is the way I went to France. And when they put me in the fermentation technology, they used to take us every now and then to visit breweries where they sent their yeast and they made their champagne. I recall the first time I tasted champagne, it was bitter and and bubbly, and what for? Why are people paying so high for such a odd story? Today I love champagne, but that was the time when I first had it. So in any case, they were doing preparation of yeast and things of that sort. So I wasn't very happy, and I used to ask them questions. They shifted me to another department in which Jacques Monod, we ultimately got the Nobel Prize. He was the chap. So I shifted there to work. So like that, we worked there. But, this was the problem given to me at that time was, not very satisfying. I sort of took to it because I had to get a degree. And now another interesting story was that at that time, it was the post-war years, the expensive equipment items were numbered. So the department had one Tiselius electrophoresis apparatus. You had to sign to get your turn, which came usually 2-3 weeks after. But I saw that after 5 o'clock, nobody was working there. So why not come at 5 o'clock? You will have the equipment every day at your disposal. So, that's how I used to come after lunch. At Pasteur in France, this is the liberty. You come when you like to, which I had practiced at my own institute, also come when you like to. So anyway, I used to set up my experiment, but then there were 2-3 hours gap. So each evening I would go to a theater or to a opera or to a musical concert, because the students used to get cheap tickets for the best seats. So I benefited that, but I also got sort of dipped into all the culture, the best culture of the world, which is a side product of my studies at the Institute Pasteur. So that is how it happened. I'll tell you more on what I did
that's
back in India. As a student, it's their work. But anyway, I worked on mechanism of action of hormones, growth promoting hormones, how they act. And that work also is well recognized. Many of them are published in PNAS and very good journals. But after 1970, when when this immunology people came and put me with shame to learn that we have world's largest number of lepers, I shifted to working on issues which are important and meaningful. And besides leprosy vaccine, which I brought to the end, and it has found so many uses, more than in leprosy, tuberculosis. In addition, I have made a vaccine for control of fertility by birth control vaccine. That also underwent not only safety trials, phase 1, but also efficacy trials, phase 2. And it is again published in PNAS 1994. This is a vaccine which has used a subunit of human chorionic gonadotropin in the pregnancy hormone HCG, linked to a carrier to make it immunogenic because it's a self-hormone. So it's a vaccine made in by that way. Why HCG? Because it's normally not there in the healthy body. It only comes in when pregnancy starts. That's why it's a test for pregnancy. So I chose this as a target to make this vaccine, because that vaccine then will produce antibodies which will not react against anything normal in the body, and it will only be reactive when the pregnancy starts. At that time we didn't know, but HCG plays an important role in implantation of the embryo. So the embryo fertilized has to implant in the uterus, and HCG has a role which we know now. So the vaccine producing antibodies against it would not let that happen. And it will touch nothing else in the body. So this vaccine is unique. There was only one pregnancy in 1224 cycles, so it's highly effective, better than in most of the contraceptives. And the women keep on ovulating. There is no derangement in their menstrual regularity, which stays, because you see the HCG is not there in the normal woman and non-pregnant. So therefore it's a unique vaccine. It is, when I left NII, my successor said, please leave the vaccine here. So I said, okay. And it was developed at NII, so why not? And now you see he did nothing on it. This is one of the shortcomings of our country. There is rivalry. And people don't take advantage of what your predecessor has done and take it ahead, but they want to crush his reputation. So he buried the vaccine. So for many years it was lying buried somewhere. Then recently a committee, an American committee, asked me, can I revive the vaccine? So I have revived it now. I've made it into a genetically engineered vaccine. And that has, progressed to a point where it is approved now by the RCGM. It took 5 years to get that approval. And because you have to do a lot of safety studies, they thought genetically engineered चीज तो शायद हवा तो नुकसान करेगी. And I had to do all types of toxicology studies. And all that work was done from this little lab.
No.
And you see then it's now approved. ICMR is going to conduct a clinical trial on this genetically, which by the way started, but with the COVID coming in, everything has been shut down for over a year and a half. So sitting where it is, this is hopefully it will be completed in my lifetime, hopefully. I'm hale and healthy, but still I am advanced in age. Let me tell you another important application on which we are doing currently work in my lab. You know, the advanced stage, terminal stage cancers, when they become drugs resistant, या वो डॉक्टर कहता है अब इनको भगवान का नाम दिलवाओ, हमने जो करना था कर दिया. At that stage, many of them start expressing ectopically HCG, this human chorionic ectopic. So we are making an immunotoxin, again a genetically engineered one, where a part of the antibody is linked to a toxin, and it kills. We have got 8 cell lines developed from such cancer patients. It kills those cells in vitro, But you see, between this and it's actually becoming a clinical product, there is still a long road.